From Vermont Public, this is The Frequency. I'm Mitch Wertlieb. It's Thursday, October 30th, and here are today's headlines. Health insurance premiums could go up by about 7% on average next year for Vermont's teachers. That's what the self-insured trust that manages health benefits for school employees is proposing. Premiums could have gone up nearly 20%, but trust manager Mark Hage credited lawmakers and state regulators with acting to significantly reduce drug and hospital prices.
That combination of legislation and regulation was enormously impactful and allowed us to be able to offer our member groups and school employees and their dependents a single-digit rate increase.
Hage says it's the first time since 2023 that rate increases were not in the double digits. The trust is called the Vermont Education Health Initiative, and it covers about 33,000 school employees and their families. The co-founder of Ben & Jerry's accuses the company's owner of preventing it from developing a flavor in solidarity with the Palestinian people. Ben Cohen told The Guardian that Unilever blocked the flavor that was approved by Ben & Jerry's independent board a year ago. A spokesperson for Unilever told The Guardian that its leaders did not think it was an appropriate time to develop the product. The ice cream company's independent board launched legal action against its parent company last year. It accuses Unilever of attempting to block its efforts to make a statement in support of the Palestinian refugees in the conflict in Gaza. Unilever currently has plans to shift ownership to its spin-off brand Magnum, but the federal government shutdown has delayed the shift. The University of Vermont Children's Hospital has received a $25 million donation. UVM Health says in a press release it's the largest gift in the network's history. Billionaire Tom Gasolano made the donation. It will be distributed over the next 5 years. UVM will use that money to expand its services for children with complex medical needs. The Children's Hospital will be renamed Gasolano Children's Hospital at University of Vermont Health. The gift also includes an invitation to join a network of other hospitals that he's financially supported called the Gasolano Children's Alliance. The goal is for those facilities to more easily share resources. UVM was one of 6 hospitals to receive a gift from Gasolano this week. And a former Democratic state senator and business owner from Rutland has died. Bill Karras was 81 years old. He was known for his success leading Karras Reels, a business his father started in Rutland in 1951. Karras eventually turned the multi-million-dollar company over to its employees. He entered politics in 2006 and served 3 terms as a popular Democrat in a county that leans Republican. Former Rutland County State Senator Kevin Mullen says Karras's popularity crossed party lines and made him a gifted lawmaker. He remembers Karras as a champion of the arts and substance abuse recovery.
I think the main thing to remember is that Bill saw value in everyone, and he would go to bat to try to make sure that people got a second chance in life.
Karras is survived by his wife Barbara and their 4 children. Coming up, with more than 60,000 Vermonters at risk of having their supplemental nutrition benefits cut off in just a couple of days, Governor Scott and legislators in Montpelier have crafted an emergency plan to keep SNAP benefits available during the government shutdown. We'll have details on the plan after this. Governor Phil Scott and legislative leaders agreed on a plan yesterday afternoon to use $6 million in state funding to ensure Vermonters can still access federal nutrition benefits for the next 15 days. Roughly 63,000 Vermonters depend on those benefits each month. Vermont Public's Bob Kinzel spoke about the developing story with host Mary Engish.
Can you start off by telling us why this action was necessary by Governor Phil Scott and legislative leaders? Like, what precipitated this crisis?
Sure, Mary. Because the government shutdown was going on, money for the SNAP program runs out this Saturday, November 1st. And this means that essential benefits would not be available until the shutdown is over. Now, there is a federal emergency fund to continue operating the program, but the Trump administration won't release that money. And I think state leaders felt that the thousands of Vermonters who rely on this program had to be protected because this is a critical and a very basic issue. We're talking about food. So that's why a state plan was developed today to keep the benefits available for the next 15 days.
And when will these funds be available to SNAP recipients?
Well, Mary, it's going to take the state up to a week to set up a system to be able to put this money into federal accounts of the recipients. And that's important so they can still use their electronic cards. So in the meantime, the plan is to appropriate $250,000 to the Vermont Food Bank so it can distribute additional money to local food shelves to meet the increased demand during this initial time period.
Yeah, in addition to today's state plan, are there other efforts to restore funding for the SNAP program?
There are, Mary, there too. The most immediate is a lawsuit filed by Vermont and 24 other states asking for a temporary injunction to require the Trump administration to make those SNAP emergency funds available. The states are asking a federal judge for a decision by Friday. And this could have a direct impact on the state plan to backfill this money because the state money might not be needed if the injunction is granted. And there's also a bipartisan bill sponsored by 11 Republican senators and Democrat Peter Welch of Vermont to fund the SNAP program during the rest of the shutdown. But Republican leaders say they won't bring the SNAP bill up for a vote unless President Trump supports it. And so far, that hasn't happened.
And Bob, what happens if the shutdown continues for a few more weeks?
Well, the special panel has scheduled a meeting for November 13th to see if any additional state action is needed. Is the shutdown still going on at this time? Now, while there seems to be support for using state funds for this program, I think there's also a recognition that the state is somewhat limited in what it can do if the shutdown exceeds for a long period of time. And that's partly because the state does not expect to be reimbursed for the money that it spends on SNAP benefits.
And one last question, that another program that could be affected by this shutdown is LIHEAP. That's the one that provides fuel assistance for low-income Vermonters. Can you tell us a little bit more about that one?
Sure, Mary, there's good news here. The plan announced today is for the state to send out the initial payments for this program in the middle of November at a cost of roughly $15 million. And in this case, the Scott administration does expect to be reimbursed by the federal government for these expenses whenever the shutdown is over. So that's good news for the thousands of Vermonters who rely on this program.
Vermont Public's Bob Kinzel. Bob, thank you so much for this update.
My pleasure, Mary.
Thanks for listening to The Frequency today. We had additional reporting from Lola Dufour, Adia Gulston, and Nina Keck. Today's episode was edited by Stephanie Colombini, and our music is by Blue Dot Sessions. I'm Mitch Wertlieb. Talk to you tomorrow.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.